Hi there, my name is Elizabeth Hennen, and my presentation today is going to be on a study on the effect of gender-affirming hormones on athletic performance in transgender men and women. The study was conducted by Dr. Timothy Roberts of the Children's Mercy Hospital in Kansas City, Missouri, and his colleagues Joshua Smalley and Dale Arendt. So what is the purpose of this study? The purpose of this study was to determine the performance gap between cisgender athletes and transgender athletes with the use of gender-affirming hormones. Dr. Roberts and his colleagues studied the effects of the use of estrogen and testosterone on transgender athletes. And then the data collected from this study was then used to guide sporting organizations and legislators such as the World Athletics Committee, the IOC, and the NCAA in remodeling the current policies and regulations for transgender athletes. So here's just a little bit of background information. The current World Athletics Organization and the International Olympic Committee, or the IOC, guidelines require transgender female athletes demonstrate the suppression of testosterone levels to less than 5 to 10 nanomoles per liter for at least 12 months prior to competing in women's events. It is known that the administration of testosterone in transgender men increases muscle mass, thigh muscle volume, hemoglobin, grip strength, and thigh strength. And then almost the opposite can be said about the blockage of testosterone and the administration of estrogen in transgender women. However, transgender women retain the advantage over cisgender women in muscle mass, volume, and strength after 1 year of estrogen. We know how these gender-affirming hormones change the individual's body composition, but we don't quite understand, and that's what the purpose of this study is for, the effect that these gender-affirming hormones have on an individual's athletic performance. The study included the participation of 29 self-identified transgender men and 46 self-identified transgender women who are active members in the United States Air Force. Each service member's age, service branch, military rank, gender they were assigned at birth, the date that hormone therapy was first administered, as well as the days between starting the hormone therapy and the first test of the hormone levels were all recorded. Here's how the study worked. So the United States Air Force requires service members to complete a physical fitness assessment every 12 months. This assessment includes the measurements of the number of push-ups and sit-ups completed in 1 minute each, as well as the time it takes for each service member to run 1.5 miles. Each service member's height, weight, and waist circumference was also recorded. Pre-treatment data was taken using the most recent score of each service member in each event prior to starting the testosterone and estrogen therapy. And then data that was used to compare results to that of cisgender men and women was taken from the Air Force fitness tests performed by men and women under the age of 30 between the years 2004 and 2014. And this data was used as a proxy for the average performance of cisgender men and women in the Air Force to compare to. An estimated mean of the number of push-ups performed in 1 minute, the number of sit-ups performed in 1 minute, and the 1.5 mile run times was recorded in 4 different time periods. Those time periods being before the testosterone and estrogen therapy, between 0 to 1 years on hormone therapy, between 1 to 2 years on hormone therapy, and then finally over the 2 years on testosterone or estrogen therapy. And then these results were then compared with the average performance of cisgender men and cisgender women. So the main limitation of this study is that there are no standardized protocols for administering testosterone or estrogen. The variations in the exposure of these hormones could have a surprising outcome on the effects of testosterone or estrogen on the athletic performance and body composition. The time period between administering the hormones and the individuals exhibiting changes in physiologic levels also varies widely between the participants. And then a quote from Dr. Roberts in this study on the study limitations is that we do not know to what extent this variability represents differences in medication dosing or whether it's inadequate access to medical records from outside the military healthcare system. All right, so let's take a look at the results. In each graph that I'm about to show you, the dashed line here will represent the average of cisgender men in the study, and then the dotted line will represent the average of cisgender women in the study. The red line will represent transgender women, and then the blue line will represent transgender men. Let's look at the push-ups performed in 1 minute. So prior to OE estrogen therapy, transgender women performed more push-ups than the average cisgender women. And then the study found that after 2 years, there was no gap left. Then prior to taking testosterone, transgender men performed fewer push-ups than average cisgender men. But after 1 year or so of testosterone therapy, the gap was closed. For the number of sit-ups performed in 1 minute, prior to OE estrogen therapy, transgender women performed more sit-ups than the cisgender women. But after 2 years, the gap was almost non-existent. Prior to testosterone therapy, transgender men performed just slightly fewer push-ups than the average cisgender men. After about 1 year, it was both levels were equal, but then they went on to exceed the average cisgender men. For 1.5-mile run times, the run times of transgender women prior to OE estrogen therapy were faster than cisgender women, and after OE estrogen therapy, they consistently remained faster than cisgender women. And then prior to testosterone therapy, transgender men had slower run times than cisgender men, but the gap was closed after about a year or so of testosterone therapy. So how do we interpret these results? As I said before, the current guidelines for transgender women require that each individual have been on testosterone suppression therapy for at least 1 year in order to compete in women's events. With the information gathered from this study, Dr. Roberts and his colleagues would suggest to the World Athletics Organization and the IOC that more than 1 year of testosterone suppression should be required in order to compete. What did we learn in this study? We learned in a study that trans women retain an advantage in upper body strength, meaning the push-ups, over female controls for 1 to 2 years after starting gender-affirming hormones, as well as that transgender women retain an advantage in endurance, the 1.5-mile run, over female controls for over 2 years after starting gender-affirming hormones. And then the importance of this study was to confirm the effects of gender-affirming hormones on athletic ability and performance in order to better advise the World Athletics Committee and the IOC in creating more inclusive guidelines and regulations for transgender athletes. And that is all I have for you guys today. Thank you so much.